Hello, I'm Dr. Beech, and just the other day a patient came in and asked me a question that stimulated in my mind the need to make a video. And the question was, why do you, in her terms, snap my neck? And so first of all, let's talk a little bit in this video about what's actually happening when we adjust the spine and what makes that sound that people refer to as cracking or snapping. We call it a chiropractic adjustment, or a more general term is manipulation or chiropractic manipulation. What's actually occurring when we do make an adjustment is that in the joint itself there is fluid, nitrogen that's in fluid, in a solution. And when we move the joint quickly, that nitrogen comes out of solution and forms a gas. And the gas that it forms will create a little change of pressure. So we get that popping sound. It's called cavitation, and that's what creates the sound. We're not cracking anything, we're not snapping anything. If that were the case, I don't think our profession would have survived over the last 110 years or however long it's been around now. And but nevertheless, that's how it's often characterized by the public. But I wanted you to understand the mechanics of what's going on there. And then the other thing is, why would we, in this case, the reason this patient was asking me is she came in with a low back problem, and she wanted to know why I was working on her neck when her pain is in her low back. It's a perfectly legitimate question. And what I explained to her is that when I looked at her whole body, I found that her feet were out of balance, and we'll do a whole nother video just on the feet, but how the feet were out of balance and creating a postural problem that was causing her head to go forward like this. And that forward head tilt, as we call it, was putting a great deal of pressure on her neck. It also, at the same time, causes one to arch their back and put pressure on the low back, which is where she was getting symptoms. And that's why she came in. However, in order to correct even the back problem, I have to correct the whole posture. You can't take the body out of isolation. So to create the pressure that was correct the pressure that was on the low back, we also had to correct the pressure that was in the neck. Therefore, I was also adjusting her neck, or as she called, snapping the neck. And once I explained that, it made sense to her why I was treating areas where she wasn't having symptoms. And this points out something that I want all of my patients to understand, that chiropractic is we have a different theoretical sort of model than we've been used to using in healthcare, which is we don't always use a symptom treatment approach. In modern medicine, we do treat symptoms. Basically, you go in, the doctor says what hurts or what's your problem or what's going on, and then they design treatment for that problem. In chiropractic, we do obviously look at your problem and your symptoms, and we want to treat that. But we try to take a more holistic approach and look at what are the underlying factors that might be causing that problem, and then treat those factors as well. In that way, we're not just hiding a symptom, as I say, cutting the wires to the fire alarm. We're looking at trying to put the fire out in the first place that caused the body to respond with those symptoms. And therefore, we may be treating areas that aren't symptomatic, that doesn't have any pain, but will give an overall effect of creating balance in the body. So this is the reason that we may be adjusting areas. It might be the foot, it might be the shoulder, it might be the neck or back or a rib or some other area that may not actually even be in the mind of the patient a problem, but in our analysis we've determined to be part of the overall etiological factor that's creating that pain and therefore in need of treatment. So I hope you've enjoyed this explanation, and I'll talk to you next time.